Hey, good afternoon, good evening, or even good morning, depending on where you're viewing this video from. My name is Dr. Obi, and I want to have a quick conversation on a topic that is relating to mainly women, and it's a topic of contraception. When it comes to contraception, there are two major ways you can look at it. One group that are hormone-based and the other group that are non-hormone based. So the hormone-based one are called hormonal, and usually either it's a combined pill which contains progestogen and estrogen, or a single pill, the one that contains just progestogen. Now, I'm particularly interested in the combined pill. If you are on a combined pill, which usually these contraceptives is for different reasons, or more importantly, to prevent unwanted pregnancy. If you're on this pill, I want you to please pay particular attention to your body. There are recent reports of blood clot and cancer being linked to this combined pill. It's not alarmist conversation. It's just to provide information that people will be able to use it and make informed decision. Now, blood clots can happen on your leg, usually on one leg. It can happen on your lungs. It can happen in your head. Now, on your legs, what happens is a sudden pain that is warm. You could have swelling on that leg. If your first skin, the leg might be reddish, and you could see the redness. And if you touch it, it's warm. Sometimes if you touch it, you can feel, a knob or kind of lump. If it's on your chest, it's going to be so tight and painful, and you're breathless. If it's on your head, it could also be severe banging headache. Now, if you're having any of those, it's better you go and check it out. And you're told that it's nothing than you trying to endure, and it's actually something to worry about because blood clot is a medical emergency. So time is of essence. This is particularly important for people in certain culture and certain community where enduring pain is seen as a strength. It's not a strength, it's a medical emergency. Go and get it checked out. Let somebody have a look. Please remember to tell them that you are on combined pills. Now, cancer, two main cancers have been linked to it. Number one is breast cancer. The second one is cervical cancer. Now, the breast and the cervical cancer, which is the reason why, if you're in a country where their system automatically invites you for breast or cervical cancer screening, please do not skip that appointment. For every woman, especially if you're on those pills, right? It's better safe than sorry. Now, if you go for the test, be able to pick out where if any change is happening very early. If you're in a country where you don't have a system that automatically invites you for these tests and you're on combined pill contraceptives, do yourself a favor, because the usual thing is for breast cancer, for breast screening, is every 3 years. And for cervical screening, it's every 5 years. You can start saving money and go and do those tests if you're on those pills. The pill is not only for trying to prevent unwanted pregnancy. There are different reasons why that is taken, but whatever the reason is, if you're on those pills, please look after yourself. For breast, every woman should be able to, especially if you start having your period, and more so if you are now on this pill, able to check your own breast. If there's anything unusual for you, go to your healthcare professional, let them have a look and check it. If there's nothing, good. If it's something, at least you'll be found early. Let's look after each other. Let's look after ourselves. We can look so pretty, but we need to also be able to be aware and be able to look after ourselves internally as well. So you look after yourself, please spread the word. Breast cancer, cervical cancer, we can prevent it by early detection. Blood clot is a medical emergency. There is nothing you're gaining by enduring. You gain by checking yourself in with your healthcare professionals and get that sorted before it causes more problems. For blood clot, people have had heart attack, stroke, or even death. It is a medical emergency. It needs to be sorted. Look after yourself, and I'll speak to you and I'll see you soon. Spread the word. Bye.